Diabetes mellitus is a chronic condition that is characterized by raised blood glucose levels resulting from defects in insulin production, insulin action, or both. According to Statistics Canada 2012, diabetes ranked number 6 among the leading causes of death in Canada. It accounted for about 6,993 deaths in 2012. Today's agenda: introduction, background information, rehabilitation strategy or program, and multiple choice questions. The agenda for this presentation is as follows. First, there will be an introduction to diabetes. Next, the background will be introduced. This will be followed by a list of some rehabilitation strategies or programs currently used in controlling or managing diabetes. Finally, some multiple choice questions will provide the key messages of the presentation. The term diabetes mellitus describes a metabolic disorder for multiple causes, which is characterized by chronic conditions resulting from defects in insulin secretion, insulin action, or both. If not controlled or well managed, diabetes can damage blood vessels, nerves, and may result in failure of many organs like kidneys and heart, which can consequently lead to complications or death. Epidemiology of diabetes. In 2010, it was estimated that about 285 million people were suffering from diabetes globally, and this number is expected to increase to about 430 million by the year 2020 if preventive measures are not taken. Presently, over 2.7 million Canadians have diabetes, and it has been estimated that this number will grow by 1.5 million over the decade to 4.2 million by 2020. It has been shown that the prevalence of the disease increases with age. This is because 57% of the Canadians suffering from diabetes are of working age, between 25 to 65 years in age. Report has also shown that the prevalence was higher in males than females, 7.2% in males and 6.4% in females. Newfoundland and Labrador, Nova Scotia, and Ontario ranking highest in prevalence. According to Health Canada 2012, the rate of type 1 diabetes among children is on the increase. An increase from 0.1% in 1998-1999 to 0.2% in 2008-2009 was observed among Canadian children. In 2008-2009, more than 3,000 Canadian children and youth were also diagnosed with both type 1 and type 2 diabetes, which brought the total number of prevalent cases to around 26,000. Age standardized rates show the prevalence of diabetes was 17.2% among First Nations individuals living on reserve, 10.3% among First Nation individuals living off reserve, and 7.3% among Inuits, compared to 5.0% in the non-Aboriginal population. Type 1 diabetes account for about 10% of diabetes cases, and it usually starts in childhood or early adulthood. Type 2 diabetes account for about 90% of all cases of diabetes, and almost 30% of the type 2 diabetes patients do not know they have the disease because symptoms are mild. Background information. Sugar is a primary source of energy for the human metabolism. Diabetes is a disease in which the body is incapable of producing sufficient or any insulin, which causes fluctuation in blood glucose levels. Symptoms are frequent urination, fatigue, irritation, and blurred vision. There are two forms of diabetes: insulin-dependent diabetes mellitus, which is type 1, and juvenile onset diabetes, type 2. Shared features: elevated or low blood glucose levels due to absolute or insufficiencies of insulin. Insulin is a hormone that is produced by the pancreas to regulate blood glucose levels. Normal working insulin lowers blood glucose levels when it's high. When the blood sugar levels are low, the secretion of insulin also drops. Type 1 diabetes, considered an autoimmune disorder. Immune system destroys beta cells, which are insulin-producing cells, incapable of producing insulin, which usually begins during childhood or adolescence. Risk factors are family history, genetics, and geography. Type 2 diabetes, the most common form, 90 to 95% of cases. Conditions where there are resistance in insulin response. Common effects are rise in blood glucose levels after a meal. Risk factors are obesity. The more fatty tissue present, the more resistant cells are to insulin. Family history, if parents or siblings have type 2 diabetes. Race, age, as you increase in age, the more likely you are to get diabetes. Pre-diabetes, which is blood glucose levels higher than normal but not enough to be considered diabetic. Diabetes is likely to be linked to disability through various pathologies such as hypoglycemia and onset of proliferative retinopathy. As a result, diabetes causes various disabling complications such as immobility, peripheral neuropathy, cognitive change, amputation, stroke, and falls. In the United States, disability secondary to diabetes affects the approximate range of 20 to 50% of the diabetic population. Therefore, it is important to establish a diabetes education and self-management program that enables the victims to achieve and uphold an optimal functioning in the interaction with their surroundings. In this case, the rehabilitation program includes both the community-based and the inpatient sites. On the other hand, the inpatient care provides services for the patients in nursing facilities and rehabilitation centers. On the other hand, the community-based care provides services to patients in independent or hospital-based clinic in the homes and in the in-day hospital settings. Such programs needs an integrated care between the hospital specialists, practitioners, and other affiliated on the healthcare term. The program also includes a multidimensional approach that emphasizes on prevention of diabetes and the associated complications. For instance, the approach takes into account of the following: timely interventions of vascular disease, disability assessment, other geriatric syndromes assessment, overall strategy to enhance the well-being and the patient's normal life expectancy. An integral part of this rehabilitation program is the patient education that provides the patient with the individualized channel of care which is based on their specific needs. The education will also empower the patients to self-manage their daily care of their diabetes. The program also incorporates exercise, personal nutrition, and medication plan that involves techniques such as understanding the blood glucose levels, identifying, evading and treating low blood glucose, responding to high levels, timely and appropriate medications, monitoring the kidneys and heart, achieving the nutrition goals, appropriate physical exercise to maintain control, and lastly, managing stress and increase motivation. Research conducted by Cote attempted to determine whether the benefits of a single education and self-management structured program for people with diabetes are sustained at 3 years. The results indicate that the glycated hemoglobin levels have decreased in participants at 3 years. The single structured education program implemented by the adults with type 1 diabetes indicated clinically significant improvements in glycated hemoglobin levels with no increase in severe hypoglycemia during the period of 2 years. Although the research supported that the program for the ongoing models of education, it indicated that the contact time and optimal interval requires further evaluation. The authors of the article suggest that follow-up supports is required to create additional benefits for assisting the patient to identify their routines. The study have several strengths. The study constitutes of a large sample size and representative of individuals with diabetes and hence enhance the widespread generalizability. The study minimized the contamination between practices successfully. It had a strong cluster randomized design with rationally well-matched participants in the intervention and control group. The educators in this intervention were quality assured and fully trained, and hence ensures generalizability of the findings. However, the study lacked sufficient power to determine significant differences in cardiovascular or mortality events. In addition, the study included a non-response bias with responders being less overweight, older, and recording more depressive symptoms.